Welcome back to ThinkTech Community Matters. I'm Jay Fidell. We're going to talk to Dr. Scott Grosskreutz, who is a radiologist in Hilo, about whether Hawaii is paying enough attention to healthcare. Scott was in a very interesting point-counterpoint program that we did about a month ago. It was chaired by John Wyhay, did a great job. And Esther Smith was there, a colleague in Kona. And we had Hilton Raphael, who used to be HMSA, and now he's Hawaii Healthcare Association. Oh, and Vicky Caetano, who was our citizen observer and commentator, who always does a great job. She comes on a lot of our shows. So what a panel that was. And right after this, I'm going to ask the staff to play the video of that program again, okay? Challenges to healthcare in Hawaii. So Scott, welcome to the show. Thanks for coming on today.
Oh, thanks for having me, Jay.
So last time we spoke was in May. Now, since then, we've had the veto practice and the signing practice by Governor Green. How did that work out for the physicians, for the healthcare industry?
I think a lot of positive things happened this past year, and much of that happened with Governor Green's leadership. There seems to be a growing appreciation that, we do have a serious, shortage of healthcare providers, particularly in primary care in Hawaii. And that unless we take fairly urgent steps to address these problems, we're just not going to have nearly enough, doctors and nurses and APRNs and PAs to take care of our population. We have about half of our state of the providers are in small private practices, and a lot of those are under considerable stress. So some of the things that came that were very helpful is Governor Green signed a number of bills that to expand the medical school class over at JABSOM, so we have more locally trained doctors. There was a bill introduced that didn't pass, but nonetheless there was funds that were integrated into the state budget going forward to increase the amount of payment for Medicaid patients, which is a state partial federal program, to Medicare levels. So that was a big plus. Some of the other things that are kind of happening, I think, just in terms of general health, is the governor is focusing on care for the homeless and how to get them housing and mental health services and medical care. And then that's just, we'd all completely agree that that's just a huge need in our state.
Yeah, we have a lot of needs. So you spoke at the panel and otherwise about the gross excise exemption for doctors. Can you talk about the background of that and what happened?
Yeah. So, basically, and this is an oversimplification, but it's largely true in Hawaii, because the cost of providing healthcare services are so high, like the cost of providing any business service in the state of Hawaii. And the reimbursements from the federal government for the Medicare program are so low that frequently healthcare providers, that includes dentists and doctors and nurses and others, mental health providers, they can't make enough profit in order to be able to keep their offices open, keep their staffs employed, pay their mortgages. And one of the challenges on top of that is the state general excise tax is a tax that's levied on gross income. They've changed that, and when we just met with the Medicare team, they're called the CMS. They were visiting the state of Hawaii, and I had a chance to visit with their team about 2 weeks ago. Said, "Hey, good news! The State Department of Taxation is no longer advising, healthcare providers to pass that state tax on." And again, the insurance specialist that was visiting said that's very good, Scott, because that's Medicare fraud. And so I think there was just
Oh, just a little fraud. I
yeah.
guess they won't do that anymore.
So it's good we're not actively encouraging people to get themselves in hot water by getting themselves investigated for what would be considered fraudulent activity. But on the other hand, we weren't able to get the general excise tax exempted for medicine for private practice. And the GET tax is basically a tax on gross income. So say you're got a private practice and you are kind of breaking even and on Medicare patients. And then you come in and the state GET tax is, 4% plus the county surcharge, which could be as high as 0.7. So you get a high of 4.7% on your gross revenues when you haven't, maybe made a dime caring for those patients. And what that, of course, does is it just causes, clinics to lose money. And we introduced a bill, SB 1035, that was put together with Tommy Yamashika, the president of the Hawaii Tax Foundation. Had broad support in the legislature. The state Senate unanimously passed it on third reading. Every House and Senate committee that heard the bill, including the House Ways and Means Committee, passed it unanimously without a single no vote. Then the House Finance Committee declined to hear it. That's still kind of problematic. It's back in another life, I used to be a Navy doctor and was trained as a deep sea diver in the Navy. And also before that, and when I was younger in high school and college, I was a water safety instructor. And one of the things, if you have somebody that's drowning, and they're 10 feet at the bottom of the ocean or the pool, you get them to the surface. That's the first thing you do. And what we've kind of done by moving the Medicaid rates to Medicare levels, where basically still people are financially underwater, we've taken the drowning victim and we brought them to 2 feet of the surface, and they're still underwater and they're waiting there until next session. So I just hope we don't lose too many more, many practices between then and now, and hopefully that can be addressed.
Yeah, that's an interesting metaphor because my sense of it, and you can correct me, is that we may be doing a little this and a little that, a little here and a little there, but that's not going to have a big effect on the doctor shortage and the increase in the doctor shortage and the nurse shortage, and the process of by which the small doctors, small practices wind up hiring themselves into big hospitals, which is not necessarily good for the public. So Norman Rockwell, the Rockwell doctors, if you know my reference, remember that great painting of the doctor in a physician's office in the 30s with this kid, and the kid is all imbued with the doctor. That kind of doctor really cares, and so forth. So the process has been going on for a while. We have a shortage of 800 doctors now, and I don't know how many nurses. And this shortage is still going on. So what we're doing, it's like we're still 2 feet below the water level, and we got to do more. Are you satisfied with what we're doing?
I think that there's a lot of goodwill now to address the situation, and there was a insurance industry study by Sunset Benefits that we shared with our Hawaii Provider Shortage Crisis Task Force recently, and it basically used census data from the U.S. government and few other databases, and it took a look at primary care shortage areas, health professional shortage areas is the bureaucratese for that. But that's when you have more than 3,000 patients for every physician in the community for primary care providers. And they took a look at all 50 states. Some states had no, primary care shortage area that met that definition. Many were 1 to 2 to 3%. And Hawaii, unfortunately, was number one, where 35% of our population was a health professional shortage area, where they didn't have enough primary care people, to take care of folks. And that was over 500,000 of our population. The state with the next highest was Wyoming, and where Hawaii was 35% or over a third. Wyoming was 27%, a little bit over a quarter. But Wyoming is a very, it's a large state. People are spread out all over the place on ranches and things like that. So really, for our size, we have a serious problem, and it just kind of goes to show that this is being recognized in survey after survey and study after study. And as was raised during our last conversation with Hilton and Vicky and Governor Waihee, we have a two-tiered healthcare system in the state, where if you live in Honolulu among many big hospital systems and you have lots of providers and you get excellent care, that's great. Your healthcare statistics are going to be good. If you live in a neighbor island community where you don't have anybody to take care of you, and you use the ER as your primary care provider, that's going to be a very poor and expensive way to provide healthcare. And the mortality rates for all kinds of conditions, heart attacks and strokes and cancer and trauma and suicide and teen and adolescent deaths, hepatitis C, COPD, they're all much higher on the neighbor islands, according to Department of Health statistics. And so it does make a difference.
I suppose if you had a magic graph out there somewhere, and you looked at the time it takes to get a medical appointment with either a primary doctor or some specialist, that time is going up. In other words, if it took you a week 10 years ago, it probably takes you 2 weeks now or more. I don't have the graph, but I know that out there somewhere is a graph. What is your sense of that? And how is it different on the neighbor islands as in Oahu? How long does it take to get seen?
Well, there was a access to care study that was done statewide by Community First and also with the Hawaii Rural Health Association that interviewed people across the islands, and people were reporting serious healthcare delays throughout the state, but it was mostly and particularly severe on the neighbor islands where many people were saying that they've had long delays of months or more, especially to see a specialist. And it would resulted in healthcare problems for that. The problems were severe to the point that a significant portion of the population that responded to the study was talking about leaving the state or leaving their island. Up to 40% of the people on Maui that responded said, well, I'm thinking about leaving the state or the island because of healthcare issues. And about half the healthcare providers who responded to the survey said, listen, I'm just burnt out. I can't make ends meet anymore. So I'm either going to close my practice, I'm going to move to the mainland, or I'm going to retire or cut down my hours. And so these are not significant portions of patients and providers that are seeing that they've got real stresses within our system.
Yeah, and if they can afford to get out of practicing medicine and do another chapter in their lives, I think more and more they're doing exactly that. I know some doctors who, at some point, and they're relatively young, said, I'm leaving. I had enough of this already, too much trouble. And we heard more of that in that program on challenges to healthcare. So it's a problem. The other thing is if you're in the neighbor island and you have to get to a specialist in Oahu, and that's where a lot of the specialists are, I bet you there are not too many radiologists in Hilo, as a matter of fact, now that I raised that. So
We,
if I have to get to Honolulu, I've got to get on a plane because swimming will not do it. And I have to get there soon, and I have to get there at the convenience of the medical institution I'm dealing with. And it's really a burden on my job, for example, and my life in general to have to go to another island to get seen. Who pays for this? How does that work?
well, yeah, I've always been healthy as a horse, and so I've been spoiled. But recently, I had long COVID symptoms and developed a cardiac arrhythmia shortly after that. It was probably COVID related. So I mean, I'm kind of blessed because I know, having worked here for 30 years and served as chief of staff at Hilo Medical Center, I know a lot of folks. So I could call around, I could get in to see a cardiologist, I could get referred to a specialist over at Oahu Hospital. It's got a lot of training. I'm very grateful to be able to go to a tertiary care center and try to get that fixed in July. But I mean, I can afford to do that, Jay. I mean, there's a lot of people that can't. For a lot of folks that are, just trying to make ends meet, sometimes working two jobs. The idea of leaving, their family, their children, and their jobs behind and flying to Oahu, probably not once, but multiple times, to see specialists or things like that. That's very draining, and a lot of people, uh, they simply don't do it. And as a result, we see far too many people coming in with advanced disease. If you don't have anybody to monitor your blood pressure or your high blood sugar or your COPD or all the other things that people are plagued with, and you just are forced to neglect that because nobody's available to take care of you locally. Then what ends up happening is you end up going to the emergency room for the same primary care condition where it's going to cost 12 times more than it would for your APRN or your primary care doc to take care of you. And then often you're sick enough that you're going to have to be hospitalized. And so you've got the hospital bill on top of that. And frequently the state will end up paying for that. It's just a very cost ineffective way to do this. And as a breast cancer specialist, I see people literally every week or two that walk into the clinic that have got large advanced cancers that they've known about for many months, sometimes a year or more. And they wanted to try to find somebody to get them referred and worked up, and they couldn't find anybody to take care of them. So some of these people, with a breast mass will go into urgent care centers or they will go, into the hospital emergency room. And I just would like to remind women again that you have the ability to refer yourself for screening mammography. So if you have that kind of problem, get yourself in at least for the screening, and we'll do everything we can to get you worked up. But that's just a tragedy to see people, coming in with advanced disease that would have been curable, 3 or 6 months ago.
There's a requirement that you have insurance to drive in Hawaii, and yet there are a lot of people who drive without insurance. They just manage to drive without insurance. And likewise, there's the great opportunity. This is a very liberal state on health insurance, and yet there are people who don't have health insurance. How does that affect them and the medical industry and the state?
Well, I think a lot of if you don't have health insurance, or you don't have access to care even though you have insurance, that's one of the prime drivers of homelessness, in the state. You have one episode where you break a bone or something happens to you, you can't pay your bills, you can't make your house mortgage, you're on the street. And so that's a real concern. As a state, Hawaii was kind of a leader, trying to get people, ensure that people had access to care. But we have this weird situation now where much of our population, most of our population, a high percentage has got health care, but many don't have access to care. And having health care insurance and either paying for it or having your employer pay for it, and then not having access to care is worse than not having than being sick and having that money in your pocket where you could at least fly somewhere and see somebody and pay for out of pocket expenses.
With I only heard this hearsay, but there was some report criticizing HMSA recently as not being efficient and spending too much on executive compensation, whatever, I don't know. And from time to time, we see that. The question is HMSA exacerbating the problem, helping the problem? What can HMSA do to alleviate some of these issues that we've been talking about?
Yeah, well, HMSA insures about half the state, so it's a very big insurance company. It's large enough that I know it's like a whale. It's if you are the only person selling a product, it's a monopoly. If you're the only company that's buying a product, it's a monopoly, and it's the same thing. You're so big that you control the market, and that has led to pretty serious imbalances in the dynamics between the health insurance industry and healthcare providers in the state. There's a lot of people that are saying, "Hey, listen, we're so short of providers. A lot of much of this is from our financial region. Why isn't the insurance companies, including HMSA, coming forward and raising their rates to a level that allow people to actually have a primary care doctor or a pediatrician for their kids or OBGYN, for your wife or your sister when they're pregnant? I mean, that's why you pay for healthcare. It's the healthcare providers that actually provide the healthcare. So the current system, it's working pretty well for the insurance industry, but it's not working as well for healthcare providers. So, paying people fairly, what it costs for them to provide services with a reasonable and rational profit margin is like the first thing that they could do. The other thing that's a real problem is that, and this is a nationwide trend. Insurance companies have learned that they can control costs by using what's called prior authorization. And the idea sounds good, but let's just make sure that if somebody's ordering something that it's we don't trust that doctor or that nurse or that APRN because who knows why they're ordering that test. But just to be extra sure, let's make sure national criteria are used. And and often this becomes a bit of gamesmanship where it just delays access to care in the first place. And then often legitimate, medical procedures are denied. The American Medical Association feels this is a huge issue. And it actually went so far as to approach CMS, the government agency that runs the Medicare program. I said, listen, we have a lot of abuse of the system in the United States. Medicare should do something about this, and Medicare is doing something about that. I'm not sure about the methodology, but there was a recent, survey that showed that Hawaii was among the worst places, for prior authorization abuses, where people weren't able to get access to care and legitimate services were being denied. And even when they were initially approved, sometimes they're denied in retrospect. And that's a problem. The problem in terms of an overstretched healthcare system is that, people are often, running their clinics and their practices with a skeleton staff because they can't afford the number of people that they would like, to have, to help with their patient care. And then there's about an additional 15.5 hours a week, according to the American Medical Association, the average primary care provider has to, spend or waste, depending on how you want to phrase it, and trying to jump through all these hoops. You're having to hire extra people to work the pre-authorization, and nobody pays for that. It comes out of the provider's pocket. And if people are already working, 55, 60, 65, sometimes 70 hours a week, to take another 15 hours a week of wasted time, trying to jump through all these hoops to get, essential services approved for your patients or medications, that's a real problem. And so the American Medical Association has a model bill that has a number of very reasonable elements to it. In part, says that if you're going to have to go through a pre-authorization, process, the insurance companies have to, basically make a decision on that in 48 hours. If it's an urgent thing, if it's not urgent, within several days, that there should be a review process within your own state, where the insurance company is located, and that, basically there has to be a reasonable mechanism where people have been shown to, meet national standards when they order things time and time again. That process should not be so burdensome for them. So that's something that we would hope that would be introduced into the state of Hawaii. Hawaii is only one of a handful of states in America that has no legislation or time limits on pre-authorization. And that's probably one of the reasons we've got one of the worst problems with pre-authorization or prior authorization, is because we don't have any legislation at the state level that governs that.
That bill has not been introduced before, though. That was, for example, not in the 2023 session, but you think it would be introduced in the 2024 session?
I think common sense and reasonable reforms to make sure that national standards are being followed, but at the same time aren't overly burdensome, and they don't deny legitimate care. That would be something everybody could work with. And I personally know a number of the medical directors at HMSA. They're very smart, very dedicated people that I've got great relations with. And if I go to them and say, "Listen, I've got this woman that needs this test," or because I'm not sure how extensive the breast cancer is, could we get a breast MRI or something approved? They're very helpful with that. Where the problem shows up is when insurance companies hire, vendors, and these are mainland insurance companies or mainland insurance agents that basically the more things that they disapprove, the higher their profits are.
Mm.
And so often you'll have somebody sitting in some office in New Jersey behind a desk that doesn't know anything about your field of medicine, and they're making decisions about, whether somebody should get spinal fusion surgery or things like that. And that's where some of the abuses come from. So if we could take that prior authorization process and shift it back to providers working for the insurance industry in the state of Hawaii, I'm very comfortable that things would be much better.
Yeah, indeed. It's funny that people don't seem to care about these issues. They treat them as institutional, miles away. It's not going to affect me, but it does. And what interests me is that when somebody who's famous, a celebrity, winds up with a serious healthcare issue, that makes the news. Otherwise, people are oblivious. There was a member of the British royalty in the newspaper yesterday, who has advanced breast cancer. And now everybody will be thinking about it. But why aren't they thinking about it always? Why do they have to wait for some celebrity person, The other thing I wanted to ask you is what else should be, could be, will be introduced in the coming legislature? I assume the exemption from gross excise tax will come back, but what else?
Other things that I think would be very helpful is that there's some efforts, I think, by the Department of Health and others to try to develop better programs for nurse navigators, and folks that their job in the community is to hook up patients who have a medical need with providers that can see them. I really feel that the current system where basically people on the neighbor islands are expected to fly to Oahu for most of their care, I think that's unfair. It results in health disparities and adverse outcomes. And I think that to the degree that it's possible, that we ought to develop, sustain, and augment, our healthcare systems on the neighbor islands. And to some degree, that's going to take the face of larger hospital systems on Oahu, starting more clinics on the neighbor islands and things like that. And and rotating specialists to see people on some of the neighbor islands, and I think that's well worth doing. But one of the things that, again, is most obvious, you have a lot of dedicated healthcare providers who've been working here for 20, 30 years or more. Um, just make sure that they don't go out of business. I mean, keep those practices viable, because it's a lot more difficult to build a new clinic, with all the regulations and the building permits. That can take years. It's so much easier just to keep your existing facilities open and providing care.
There are so many things, what comes to mind just listening to you is that Jabson could give reduced tuition to some of its medical students in exchange for a promise to practice on the neighbor islands for a period of years. Kamehameha Schools does that with dentists. And I think that's a very positive kind of thing to do. And it doesn't cost that much, but it gives you coverage on the neighbor island. There's all kinds of creative possibilities. One thing before we break, one thing, Scott, I want to mention, you were talking about it a little while ago, is that it's like General Motors, as healthcare goes, so goes this state. Our economy is function. I mean, think of those people who don't have the money to fly around for healthcare. That really affects their lives and their economy. And so it seems to me there's a relationship between the doctor shortage and the failure to deliver healthcare to so many people in the state, especially neighbor islands, and especially people who can't afford it. There's a connection between that and the economy, and thus there's a connection between that, you referred to it earlier, between that and homelessness. Because if you are stretched thin on your personal finances because of medical issues, you wind up homeless. A certain percentage of people do. And then if you wind up homeless with all that stress and strain, that can bring you mental health issues as well. And then you're no longer part of the economy. You're a drain on the economy, and you're a drain on the society in general. You're a burden to the rest of us. And so we have to keep you healthy. We have to keep you mentally healthy, all this stuff. So it has an effect indirectly on all of us. Do you agree? What are your thoughts on that?
You're completely right. And as you know, Jay, we've got tens of thousands of people leaving the state of Hawaii. We're hemorrhaging population. We have half of the native Hawaiian population lives outside Hawaii now. And people are doing this because they can't afford food, they can't afford housing, they can't afford medical care. We can fix that. Some of this is just a matter of overtaxation, and some of it is due to again, just not paying attention to those industries you really have to have in order to keep people here.
It's interesting. We talk about we have to pay attention to the energy industry, and we have to pay attention to the agricultural industry, but those industries are way behind the healthcare industry, because the healthcare industry, I'll be quoted on this, it's personal. It's all of us, every single one. There are no exceptions to the benefits provided by the healthcare industry. So who are championing these moves? Are there legislators? Are there doctors? Are there doctor organizations? Are there government organizations and departments that are advocating, like you do, for these changes, these improvements, these encouragements and incentives for the healthcare industry?
Yeah, I think the Senator Sam Benaventura of Senate Health, and Representative Bellotti of the House Health Homelessness Committee. I think that they've been champions. Dr. Green has been a champion. There's a lot of positive movement going forward. You've got Mayor Mitch Ross, who's been public about healthcare issues. He's come forward as an advocate. Mayor Belangiardi said, if we don't fix this problem, more people are going to die. So I think there's a broad level of support to that we realize we've got a problem, and we've got to address it, and it's just a matter of finding the political will to do so.
I remember in the 90s, there was a bumper sticker that you put on the back of your car, and it said, have you hugged your technology research assistant today? Uh, so actually, the question should be, and I know this would not go well with the individuals involved, but have you hugged your doctor or nurse today? So if somebody walked in, Scott, and said, look, doctor, I'd like to hug you for what you do, for the service you provide to me in the community, would you say, no, no, don't touch me. I can't do that. What would you say?
I'm kind of old school. I greatly appreciate when patients, are having a good experience and they're grateful that we're able to help them in some way. And so, yeah, that's one of the perks of the job is just, you know, making those human connections sometimes.
Yeah. So what do you leave with people? We have a minute or two left. What do you leave with people? I mean, to the extent that maybe they'll see this and hear it and discuss with others, what do you want them to think about? What do you want them to do?
Just some of this is so simple. I mean, I think the idea of the interstate compact that was passed to bring healthcare providers from other states more easily to Hawaii makes sense. I think expanding medical nursing school classes, to get more local kids, interested into healthcare and help cover some of their expenses. All that makes sense, but it just keeps hitting me. I mean, some of this is just, it's just simple business. It's how do you manage a budget? If you're going to be bringing people here to go into practice and they can't make enough as a dentist or a doctor or a primary care APN or mental health, in order to pay off their loans and for afford a place to live or pay their mortgage or pay their staff, they'll only be here for a couple of years until their obligations up before they leave. And I've seen dozens of people in my specialty leave just on the Big Island, and I've seen hundreds of people, colleagues, of healthcare providers that I thought were just tremendous. Many of them were fantastic providers, and they've left the Big Island. And if we hadn't just been losing, hundreds and hundreds of people every single year across the state, we wouldn't have a shortage of healthcare providers. Let's not lose them anymore.
Fair enough. Scott Grosskreutz, a radiologist on the Big Island in Hilo. I hope we can circle back with you and talk more about some of these issues and unpack them as they go forward. Thank you so much, Scott.
Aloha, Jay.
Thanks so much for watching ThinkTech Hawaii. If you like what we do, please click on the like and subscribe buttons on YouTube. You can also follow us on Facebook, Instagram, and LinkedIn. And please check out our website. That's thinktechhawaii.com. Mahalo.